The number one symptom of SIBO is bloating. And even if you're in the process of treating SIBO, bloating doesn't resolve overnight, as you know so well. What can you do for relief and healing? Well, let me introduce you to Atrantil, the first and only of its kind supplement, specifically for bloating. Atrantil is a new nutraceutical that relieves bloating and abdominal discomfort caused by gas in your gut. Developed by gastroenterologist Dr. Ken Brown, Atrantil works differently than probiotics or any other remedy. It attacks problem bacteria and the gas they produce at the source. Atrantil's 3 natural botanicals work together to produce long-term relief for these difficult-to-treat digestive symptoms while promoting a healthy gut. You have to try it to believe it. It's a miracle for some people. You can access the absolute lowest price anywhere exclusively through our link, SIBOSOS.com/bloat. Hi, and welcome to the SIBO SOS Podcast. I'm Shivan Sarna. And today, my special guest is Dr. Stefani Hayes. Dr. Hayes is a naturopathic physician, an acupuncturist, and trained in Arvigo abdominal massage therapy, which is part of what we're going to be discussing today. Dr. Hayes is an infertility and hormone expert as well, and she's one of the few practitioners who have taken a look at the connection between SIBO and infertility and what you can do about it. If you have SIBO or suspect it and have any interest in having kids at any point, this episode is a must listen. Dr. Stefani Hayes is with me, and you're going to be treated to information about SIBO, about infertility, a potential connection. I can't wait to hear what she has to say between those two things. She is a naturopath. She is someone who so many of the other people on this summit know and respect, and we are absolutely thrilled and honored to have her here. I can't wait to talk to her. I've been waiting over a year to talk to her about this, so I am very, very excited, and she's here with us, coming in live, so to speak, from Oregon. Hi, Dr. Hayes.
Hi, thanks for having me.
Oh, it's our pleasure. Let's just dive right in. You do treat a lot of people with SIBO and also with fertility issues. Tell us how you have observed a relationship between those two, if you would.
I think the relationship came about over several years of practice, especially with a lot of my patients who had unexplained infertility or fertility struggles from PCOS or endometriosis. And a lot of them didn't have GI issues. Some of them did. But because a lot of my colleagues are experts in SIBO, when I kind of got to the end of my list of things that I was doing with them and was looking for other things to explore, we started trying SIBO tests on a lot of my patients. And surprisingly, many of them came up highly positive, usually with a methane type SIBO overgrowth. Which was really surprising for us. And a lot of them didn't have the constipation pattern that a lot of methane type SIBO does. But oftentimes with that, they had constipation as young adults or young kids, but had learned over the years how to manage it. So they came in and it was no longer a struggle or an issue. So it wasn't even something that they brought up. And sometimes they literally never really struggled with much GI stuff besides some occasional bloating. But when we addressed that aspect, it seemed to make a significant effect on their pelvic bowl health and their women's health. So,
Whoa, that's so interesting. Right. They probably figured out how to do the magnesium or whatever over the years.
Mm-hmm. Yep. And what to eat, what not to eat, and just sort of self-selected with their diet, self-treated with their diet. And so then it was no longer an issue because most of my patients are usually in their mid to late 30s, early 40s when they're coming in to see me. And that's a lot of time to manage your bowels.
Yes.
And so to get to that point, it usually was not an issue, but then they were struggling with other women's health issues and fertility issues.
That is so interesting. So once the SIBO was resolved, how did the fertility rates go up?
There were a lot of my patients who did a lot better. Some got pregnant on their own naturally and were able to, hold their pregnancies and have sweet little kiddos. Others tolerated IVF a lot better and were able to, start ovulating on their own with PCOS if they hadn't before, or were able to, with endometriosis, there's oftentimes endometriosis is really tricky. And so patients who had multiple surgeries and then it regrew, I definitely saw sometimes after we balanced out the SIBO that the endometriosis would regrow slower or not at all. We would just get a little bit longer window between those surgeries so that those patients could have more options for trying to get pregnant. Yeah.
What do you think that is, that the translocation of that bacteria into the small intestine would have so many ramifications? Do you think it was like a physicality thing where simply there was the distension and so it messed up the geography there physically? Yeah. Or what do you think it was?
I've thought about it a lot, and sort of an aha moment for me came with looking at one of my colleagues' videos. He's a surgeon who does a lot of endometriosis surgeries and with laparoscopic medicine. And he takes a video during the surgery, and he was removing or moving aside the small intestine to get to the uterus. And it was a good reminder for me about just sort of basic locations of anatomy and how the organs snug up against each other. And because the small intestine does really overlay not just the uterus, but over top of the ovaries. And when I think about methane type bacteria, it's a pretty noxious gas, pretty stinky. And if I think about what that might be like, I imagine it would kind of seep into the surrounding region. And for me, I like to have visuals of things. It seems to me like a fog or a smog, if you will, that's in that whole pelvic bowl. And my perspective on that is that, when the ovaries have to have this finite, very specific conversation that they have with the brain and with the uterus. And if there's a smog present in that, it makes for a really tricky conversation. So if the ovaries are trying to talk to the brain and the brain talk back down to the ovaries, the messages could get lost. And so then in my perspective, I often then think, about longer cycles, no ovulation for many months, and this miscommunication that happens with endometriosis. We're still trying to figure out why that happens, but why in some women does the immune system not notice the endometrial tissue sitting on the ovary or sitting on the intestines and things like that, whereas in other individuals, the body cleans it up really well. And so again, it's like coming back to that smog. If the neighborhood is not very happy, then some other neighboring structures, can really get affected too, in my perspective.
I wonder if it's the body's way of protecting the host, right? So if the egg is surrounded by smog, and the body would be saying like, it's not a safe environment, beyond just that like communication thing you were talking about. I wonder if it's just like survival of the fittest kind of thing. Like,
yeah, possibly. I mean, we're not sure. It's definitely debated about the role of how SIBO can get passed in utero or not, and if it can get passed with vaginal flora or not, because we're still trying to learn about all the nuances of how flora passes between the different parts of the body, between the intestine and the vagina. And, there's all different theories about these sort of microscopic transporters of flora into the breast milk and things like that too. And so it's potentially adaptive if the body notices that there's a floral imbalance. That could be something for sure.
So tricky. It is very tricky. I think if there was a premise to the summits, is that SIBO is tricky. Definitely.
Yes.
What is your typical way of approaching SIBO? Is it the same that pretty much everyone's been talking about, either the antimicrobials or the antibiotics? And if it is, what do you do that makes maybe a little bit different? Do you have like a little secret couple of tips that you've seen helps with not only compliance, but also results?
Yeah, I think, my specialty has really become in trying to identify where SIBO might be presenting that's atypical, with the pelvic bowl complaints, with pelvic pain, even complaints also with depression, anxiety, some of these places where, mental health complaints. My approach is, if I'm suspecting it and I don't see these symptoms sort of moving away pretty easily, then I do test for it. I don't like to treat presumptively, and so I do like to make sure that it's there and give a sense of how significant of overgrowth and what we're looking at hydrogen or methane and to what extent. But then, because I work in such a big integrative clinic, I often do lean on my colleagues who know a lot about how to treat the SIBO, while I'm working with more of the blood flow component and the lymphatic flow component. I do a lot of my abdominal therapy, the Arvigo techniques, and I find that in conjunction with a SIBO treatment, whether it's antimicrobials, antibiotics, elemental diet, can be really helpful, because then we're kind of reinvigorating those organs, getting that communication pathway open back up, helping to clear out that smog with some gentle massage techniques or acupuncture. And so that's sort of how I try and support my patients a lot with that.
We've talked to Larry Warren from Clear Passage. So if anyone's listened to that episode, then you know about adhesions and the possibility of adhesions being an underlying cause of SIBO, abdominal adhesions and the organs and all that. So you just mentioned a specific abdominal technique as well. Can you just talk to us about that? Now say the name of it again also.
So the official name is the Arvigo techniques of my abdominal therapy. So Rosita Arvigo is an amazing woman, and she has sort of split her career between Belize and the States for a really long time. And we're really gifted in that she is now the lineage holder for these techniques she learned from a Mayan shaman, Donna Ligio Ponte, in Brazil, and a midwife there, Miss Hortense Robinson, and took their techniques as well as her own training as a naturopath. And she combined those into these Arvigo techniques, which it's a gorgeous massage. It's very gentle, not deep visceral manipulation. It's just a gentle massage for the belly and the back. As a doctor, I love doing the massage because it's every part of it is not just about relaxation, but it really has benefits to the nerves, the organs, working on the adhesion potential, the lymphatic flow, which is so important when there's been a long history of inflammation or congestion in the body. And so it's been a nice, adjunctive piece to my practice, that it's very well known for fertility, but it's so good for bowel disorders and chronic pain, which oftentimes does go hand in hand, but not always.
I think one of the biggest things for me that has had an impact is visceral manipulation. And when you hear the words visceral manipulation, it sounds so brutal, but in actuality, it is so gentle. I'm astonished at how gentle it is, and it doesn't cause an inflammation response, which I so appreciate. So I love this idea of her techniques. Has she trained other people around?
Yeah, she's trained probably at this point thousands of people. She has trainings internationally and in the States, and she's trained a lot of people who are now teachers of her techniques, because I believe she's still in her 70s at this point. and a grandma, so cutting back on teaching herself, but has a nice network of really phenomenal teachers and staff.
Very cool. So so it's, can you spell it for me? I don't want to guess.
Arvigo is Arvigo. It's Rosita Arvigo. It's her last name. So the Arvigo techniques, and the website is under that name. And there's a list of providers throughout the States and internationally who do that type of massage techniques or manual therapy.
Very good. Yeah, it's definitely worth a try, right? If everything else hasn't worked, why not? Why not give it a try?
For me, I feel like there's no harm in trying. I think it's relaxing, if nothing else. For some people, it's definitely able to address adhesions and congestion and blood flow and pain. And then just like anything else, it's not a good modality for others, because you're right, there are some, visceral techniques that are gentle, and then there's others that aren't. So a whole lot of options out there, and different providers interpret things differently through their hands. So
true. So true. In your practice, have you noticed in general that there's an increase in infertility? I realize that people must come to you because that's, part of their series of problems, but have you noticed that at all in your observations across population?
Yeah, I mean, it's pretty well talked about in the medical research and in the fertility community, that there's definitely an increase in infertility struggles. I think it's multifactorial, and there's lots of theories about why that might be. And some of it, I think, is also complicated by the fact that we have a lot of women who are choosing to work and prioritizing career later in their life than they might have done a couple of decades ago. And so some theories are, just even wondering about that piece, that we're looking at women who are trying for pregnancy for the first time when they're in their late 30s or early 40s, when maybe several decades ago we might have been looking more at them trying in their 20s. And that in and of itself just is a factor. But then there's lots of theories about environmental effects, and we definitely know that the eggs do age over time in what they're exposed to. And then our world is becoming, increasingly has more of a toxic burden. And so, working with providers who help our bodies optimize their ability to detoxify and balance. But there's a lot that, people have been exposed to in terms of foods and, farm exposures and water exposures and soil exposures. So.
Mold, and then the frequencies and the vibrations.
Yeah, all kinds of stuff. And so much of it is really hard to test and figure out for certain. And, that's the hardest part of those diagnoses of unexplained infertility, is sometimes we never will know, or increasingly in my practice, I'm seeing premature ovarian failure or insufficiency. So women who are finding themselves in a perimenopause state in their early 30s or late 20s. And so there's a lot that's going on that I think we're trying to understand, because there's some rapid changes, I think, in our culture, and especially and male fertility is a factor too, where the WHO has multiple times decreased what they call a good sperm count and a optimal sperm analysis, because in general our averages are shifting internationally.
Yeah, it makes sense. It makes sense. I wonder if SIBO has anything to do with low sperm count.
I think so.
Really?
Yeah, I definitely look at it in my male factor fertility patients, and I think that same idea about the local environment, that congestion can then be affecting the prostate and the blood flow into the testes, and through some of the small little tubes that are going through that region. And we've definitely had some luck. The main place I see it in semen analysis is more on the agglutination is sort of one factor. It's where the sperm tend to stick to each other and then have trouble moving around. And so that I've definitely seen improve when we treat SIBO, if that's present, because agglutination is thought to happen when there's inflammation or infection. And classically, we thought about that more as prostatic inflammation or infection, but I'm thinking about it sort of more broadly about intestinal infection, inflammation like SIBO, and I've definitely seen that parameter really change. I'm still watching with my patients to see if it helps with count and morphology. Excuse me. So morphology is about the shape of the sperm, and when they're not in a good environment to grow, it's hard to make the right shape. And so that makes sense to me too, that could be a factor.
Very interesting. Very interesting. I think you're really onto something there. And then you've had great results, right? So it's kind of hard to argue with that. Plus, I mean, intuitively it makes sense to me, but I love that we're able to even broach the subject of a connection, because this could be an answer for so many people. And then that you've been working with it with so many of your patients.
Yeah.
It's very exciting.
It's good. And I'm very thankful that I work in such a integrative community and clinic that, can make these cross system connections. And as naturopaths, we tend to think about the whole body in general, but it's nice to be able to sort of think outside the box of how things might traditionally present. And especially for, men and women who have history of chronic pelvic pain, it's nice, even if there's not a fertility component, it's nice to have another way to look at it that might be a little more gentle than some of the other options out there for, pelvic pain with my abdominal therapy and with SIBO treatment. That's oftentimes a nicer option if they can avoid surgery or, some more intense medications.
Yeah, absolutely. Absolutely. When you're working with your patients who have SIBO, if you find that nothing seems to be helping them, right? Do you have any do you do elemental diet? What's that sort of last resort for you, or that wild card for you?
We definitely do elemental diet. I don't know that anymore we think about it as a wild card. It's oftentimes so well tolerated, especially now that, Integrative Therapeutics has their professional elemental formula, physician's elemental formula, because that taste-wise is a lot better than what we had in the past with 5NX, or even the homemade elemental formula. And for a lot of patients, that's more affordable than being able to do Xifaxan or to get the herbal protocol that can get a little pricey too. I don't know anymore about what is wild card. We tend to be tenacious and really just want to, I think we think about SIBO as a chronic illness. And sort of like diabetes or something like that it, has to be managed for potentially a lifetime. There's every once in a while, sometimes like the miracle cure, one treatment and they're better forever. But most individuals, it's a lifetime worth of management, whatever that means, if it's a modified diet or, every few years getting a retreatment or just, being conscious of the decisions and choices they make. No, that's an area of weakness for them and could potentially be an area of weakness for their children. And so just kind of watching that and working on long-term management, I think, is where we often go.
I think that's so important because SIBO patients, me being one of them, of course, it's a really obnoxious condition, and we want to get well as soon as possible, and the diet component's a pain. And when Dr. Seebecker told me that it usually takes about 4 years for her patients to really figure out how to manage it so that they're not like having their lives run by their SIBO, it was, I've told the story before, but it was a relief in some ways and like real bummer in other ways. But just to have that long-term perspective that you're referring to is so good for managing expectations too.
Absolutely.
When I did my first round of Xifaxan, I thought that it was going to be, take this 14 days and you're going to be well. Well, that is not what happened to me. And very, like you're saying, very rarely happens to people. Bless them if that's happened to them.
Right.
They're probably not on this summit listening because that SIBO is long gone. But it's such a different mindset than the typical condition. And that's why my company is actually called Chronic Condition Rescue, because I am dealing with these chronic conditions and you really do need to be rescued, or you need to rescue yourself.
Yeah.
If you've not really, I don't like labels, but sometimes they're helpful. And then just to really go, yeah, this is a chronic condition. This is something that I need to manage, like you said, like diabetes or whatever. And once I tried that on as a concept, it made me less anxious because I realized that it was like, it was just a new way of being. It wasn't my preferred way of being, but it was a new way of being that if I at least embraced it and went and took the pressure off of like, I have to be well in 2 weeks, it helps.
Yeah, and I think then it's a little more empowering rather than disempowering, because if the self-expectations and the negative self-talk that can come in when somebody cheats on the diet, or, it's about finding that sweet spot where you live your life and you enjoy your life and you don't struggle with the symptoms, whether they be the, typical IBS type symptoms, or if they show up differently, like my patients have with pelvic pain or menstrual irregularities or fertility struggles, and figuring out, where your priorities lie, and then giving yourself wiggle room to also just find that balance with managing the chronic condition and finding out what life looks like there and finding the sweet spot in that. Because when it's managed well, it feels good, and my patients have better energy and better mood and less terrible menstrual cramps. I mean, even just that can, make a whole difference in life, or less migraines, or, less bouts of depression. And so looking at it from that bigger picture of, wow, then it becomes that, well, maybe those grains aren't worth it, or that wheat isn't worth it, or, and the different things, because it to them gets linked to these symptoms that are incredibly uncomfortable, even, just like the more classic symptoms of IBS are incredibly uncomfortable too.
In your practice, you were talking about how you help people with SIBO who have it manifest as also some depression and some anxiety as sort of part of the cascade. What do you think is causing that, and what do you do for them? How can we help somebody today who maybe feels anxious or has bouts of depression that could be linked to their SIBO? What's your take on all of that?
As a naturopath, we're trained in sort of understanding the physiology of the body and thinking about pathology along those lines. And what we know is that a large percentage, over 3/4 of our immune system lives around our gut. And so when there's some dysfunction with the membrane of our intestine, then some big molecules can come through that can be inflammatory to the immune system and also cross that blood-brain barrier or irritate the blood-brain barrier in a way that's maladaptive. And also, that if the body can't fully break down, let's say, the amino acids into the components where they can be, turned into neurotransmitters, and, that can be really hard for depression, anxiety. So for me, it's about finding that middle ground between helping with the inflammation component. So if it's a neurotoxic effect, like oftentimes we talk about gluten for some individuals, and depending on their genetics, gliadin, if it's not broken down well, can be neurotoxic. So that inflammatory component, and sometimes just treating the SIBO, tightening up those gap junctions in the small intestine, really decreasing that inflammation in that whole region, can help their brain, because their body is not under this onslaught of inflammation, can help their immune system for autoimmune conditions where their body is confused. Again, that smog, a lot goes on, when the bulk of your immune system is living in that smog, then it can attack the small intestine itself. Because one of the main theories about SIBO is it's an autoimmune condition, can attack the thyroid, attack the joints. So thinking about how can we minimize some of these chronic conditions, other chronic conditions, autoimmune conditions that are really debilitating. But then, the other piece of how do you optimize, because the main way to really help people with their products that build amino acids is to, hopefully help them break down their foods well for that, or give them supplements, or even if they're taking pharmaceutical medications, want to make sure that they're able to absorb them and assimilate them and get them to the brain in a way that's efficient. And you can't do that unless the small intestine is nice and healing.
What are some of the things that you do to heal the small intestine, other than, you're killing the bugs with the treatments that we know about, but what do you do? Do you have some favorite things, some favorite go-tos to help make those junctions tighter, and anything else to help heal that area?
Yeah, I think you probably talked to my colleagues and picked their brain a lot about, their secrets for nice, good things to sort of chronic management of SIBO. I'm a real minimalist, and a lot of my patients don't like taking a ton of supplements. And so I really like to do the massage that I do is really soothing the intestines, and doing acupuncture, really working with them on stress management and finding a good work-life balance, and getting some good exercise, and working with their diet. And then, because for everyone it's going to be different about what supplements that they can tolerate and what's a good choice for them to work with those gap junctions. And because it's a tricky balance, I'd say, because a lot of what we're trained in natural medicine historically for soothing are these thick, gelatinous, we call them demulcent products that can be really flaring for SIBO. So, it's a real balance of what are kind of sort of nutritive things. But I like amino acid blends to help people absorb for their brain function while we're working on these. And usually they're high enough potency, like I use Deproloft by Thorne. It has a blend of amino acids, and I find that it's a high enough amount that even for my intestinally challenged clients, absorption challenge, that they can still get enough amino acids that it helps them feel more grounded, less anxious, more rooted. But if their digestion is really compromised, then working with these 5-element acupuncture is an amazing opportunity for mental emotional balance. It's sort of a branch of acupuncture that's really specific about mental emotional balance, and having a good therapist and good support, all of that, while the gut's healing up to support that.
When it comes to Chinese medicine and acupuncture, have you ever seen a direct result of improving SIBO through maybe Chinese herbs and acupuncture versus the typical antimicrobials and antibiotics? My Chinese practitioner here where I live, she doesn't really treat SIBO, but when we would do like tonifying things for my intestines and that kind of thing, and motility in general with the acupuncture. But I was just wondering if you've ever found like a good little combination of those types of things, or is it just a tonifying?
I mean, we've definitely seen Chinese herbs are magical, and I think it's an incredible specialty. I was trained in it, but I would not say that I'm specialized in it. I think that takes kind of a lifetime of focus on it. It's a real deep ancient medicine. And my colleagues who are quite good with Chinese herbs, we find that, again, just like Western herbs, where historically the things we thought about for treating the gut and soothing the gut as being these kind of thicker herbs, these more gelatinous herbs, can be really aggravating for SIBO. And a lot of Chinese granules are incredibly aggravating for SIBO because the Chinese herbs are tacked onto corn or gluten or soy. And so then you're not getting the benefit of the herb, you're getting flared by the delivery method. And so then it usually leaves making your own Chinese herbs, which is amazing, but time consuming and really stinky and, very unique flavor profile. Some people love it. Some people hate it. And so, and the time for, cooking and decocting those herbs yourself. If you have a good Chinese herbalist who knows that nuance and really can think through, I think it takes a branching off of the classical training, because a lot of SIBO patients do need tonifying, because they definitely have a weak gut and a weak ability to absorb, but those tonifying herbs are often very sugary, very sweet. And so even when decocting them, making a tea, you still have to have an herbalist that's savvy about SIBO and knowing that certain components of these herbs and how to find that balance between the sweet ones and actually adding in more of sometimes the moving ones that just keep it from being too sticky, too cloying, too aggravating. But I think if you have a provider that can put both of those knowledge sets together, that can be a really nice option.
That would be amazing. Yeah. That would really be amazing. You're amazing.
Oh, thank you.
Amazing. Thank you so much for sharing your wisdom with us and your experiences and your observations. Because I know that there are people watching this right now who are struggling with fertility issues, and they're like, what? It could be my SIBO? Are you kidding? And so we wish you all the best. And
thank you. I appreciate you providing this forum, because for me, I'm just one provider in a clinic and seeing some patterns. And I really, want for my patients who struggle with fertility that they have some ways that they can think outside the box. And because I imagine most women and men have tried a lot of things, with their fertility issues, and to have something else that they can look at and that might be the silver bullet for them is really special.
It's very exciting. Lots of possibilities there. Thank you so much, Dr. Stefani. What a pleasure. What a delight you are. And we really appreciate you taking the time. It was worth the wait of over a year to finally talk to you. Thanks so much.
My pleasure. Thanks for having me.